Gentlemen, let's discuss openly about something that alters for every man beyond the age of 50. It's the elephant in the room that nobody wants to talk about publicly, but everyone ponders privately. Potency, stamina, and that particular confidence that arises from knowing your body will just respond when required. You may have observed that the process is slower these days. Perhaps the firmness isn't like it was before. Maybe you're facing unforeseen urinary problems, or that persistent chronic lower back pain has intensified. And like most men, you've likely accepted this as the unavoidable cost of aging. But what if I said that the decline you're going through isn't a permanent sentence etched in stone by Father Time? What if the true culprit wasn't your age, but a basic mechanical bottleneck in your core anatomy that you've unwittingly ignored for decades? I'm referring to a particular powerful pressure point on your body. A therapeutic nexus that, when stimulated for only 60 seconds daily, can essentially clear that bottleneck and reset your system. What if there existed a simple, private, active self care routine that could significantly enhance the arterial blood flow to your whole pelvic region, making sure the spongy tissue in charge of firmness receives the volume it requires? Decompress the essential nerves that control sensation and response, resulting in an evident return of youthful sensitivity. Release profound chronic tension in your core muscles, relieving stiffness not only in the bedroom, but in your lower back and hips as well. I know it seems almost too straightforward to be real. You might be doubtful, believing this is yet another odd new age health trend. Please listen to me. This particular spot, which we will locate together in detail, has been venerated in traditional medicine systems for thousands of years as the meeting of yin, the epicenter of male vitality. And nowadays, modern neurology and physical therapy are at last supplying the anatomical evidence for why this technique is so deeply effective. I'm going to lead you through a full step-by-step protocol. I will demonstrate the precise location of this powerful spot, sometimes referred to as the $1,000,000 point, the exact 60-second massage technique that delivers maximum circulatory and neurological benefit, the best natural oils that transform this simple massage into a profound therapeutic treatment for inflammation and vascular health. This isn't about swallowing a pill. It's about seizing control of your own physical destiny. It demands no costly equipment, no embarrassing doctor visits, and merely 1 minute of your time. This straightforward practice could be the missing element in your health routine that brings back your comfort, freedom, and confidence. So before we plunge into the deep anatomical truths, I have a quick request. If you are dedicated to discovering natural, proactive solutions for better health, hit that like button right now. It helps this vital information cut through the usual clutter and reach more men who require it. And drop a comment below. Tell me, what's the single biggest misconception about male aging that you want to dispel? Let's begin the conversation and build a community. Let's be straightforward about the conversation men have, or more precisely, don't have about performance after 50. The cultural narrative is strong and discouraging. Things slow down, things get weaker, and eventually you just accept it. Maybe you depend on a prescription as a quick fix, an emergency measure when you need it most. That acceptance is the biggest mistake we can make. It's the surrender that destroys confidence long before the biology does. I'm here to tell you that the decline is almost never a switch that's been flipped by your 50th birthday. It's a slow-motion catastrophe, a mechanical and circulatory chokehold that accumulates over years of modern living. Your problem isn't a sudden failure. It's a traffic jam at the most critical intersection in your body. When a man experiences a significant decline in erectile quality, consistency, or sensation, the root cause is a convergence of three mechanical issues. all centering on the very spot we are about to massage. Understanding these 3 points is key to believing in the power of this 1 minute fix. 1. The vascular culprit, arterial stagnation and stiffness. Biologically explained, the rusty plumbing analogy. Think of an erection as 90% blood flow. The penile tissue is like a sponge that must rapidly fill with blood, and that blood is delivered by the internal pudendal arteries. These arteries run straight through the pelvis. Years of Western diet, inflammation, high stress, and most critically sitting for long periods cause the inner lining of these vessels, the endothelium, to stiffen. They become less flexible and less responsive to the signals that tell them to dilate. Practically, when you're constantly sitting, gravity and pressure compress these vessels. This slows the flow, leading to stagnant blood. Blood that's lower in oxygen and higher in metabolic waste. It's like having rusty plumbing. The water pressure is low and the water quality is poor. Emotionally, this leads to a loss of spontaneity. The system takes longer to prime because the flow isn't instant. This delay creates anxiety, which further constricts blood vessels, creating a vicious cycle of performance panic. 2. The muscular culprit, the pelvic floor chokehold. Hypertonicity. Biologically explained. The chronic tension paradox. The pelvic floor muscles, PFMS, are a diamond-shaped sling of muscles controlling everything below the belt, bladder, bowel, and sexual function. The paradox of the modern man is that his PFMS are often tight and weak at the same time. They are constantly tensed, hypertonic due to stress, posture, and clenching. But they lack the endurance or strength for proper function. Practically, imagine holding a rubber band stretched tight for 24 hours a day. It's tight, but it has no snap left. This chronic tension is physically squeezing the major blood vessels and nerves that run through the pelvic region. It's literally choking off the supply line just as the signal arrives. Emotionally, this is a source of subtle, constant discomfort and tension. It reduces your body's ability to enter the rest and digest parasympathetic state, which is the necessary physiological foundation for sexual arousal. You can't be stressed, clenched, and erect simultaneously. 3. The neurological culprit. Faulty wiring and compression. Biologically explained, the garbled signal. The pudendal nerve is the superhighway for sensation and the go signal for the erectile tissues. This nerve, which originates in the lower spine, runs right through the muscular structures of the pelvic floor. When the muscles are hypertonic tight, they often pinch, compress, or irritate this crucial nerve. Practically, think of a compressed nerve as faulty wiring. The signal gets garbled, slow, or weak. The result is a dulling of sensation and a delayed or incomplete physical response. Emotionally, loss of sensitivity is often the first, most subtle sign of decline, but it's devastating to confidence. You feel disconnected from your own body, making it harder to feel the signals and harder to fully engage in intimate moments. The bottom line, your vitality is not gone. It is trapped behind this mechanical bottleneck of stiff arteries, tight muscles, and compressed nerves. The spot we are about to target is the release valve for all three of these systems simultaneously. That is the power of the 1 minute massage. Before we get to the how, let me properly introduce myself and share my philosophy. My name is Dr. Narita, and for the past 12 years, my practice in urology hasn't just been about surgery and prescriptions. It has been about finding foundational, holistic, and sustainable ways for men to maintain their total health, physical, sexual, and emotional. I've had thousands of men sit across from me. often feeling frustrated and isolated, telling me, "Doctor, I don't feel like myself anymore." They are tired of the quick fix approach that doesn't address the underlying issue. They are tired of feeling like a collection of broken parts. My guiding philosophy is this: you are not a broken machine. You are a magnificent system that needs proper, consistent maintenance. The decline you're fighting isn't a mystery. It's an anatomical issue that requires an anatomical solution. My work has led me to study deeply the principles of Eastern medicine and physical therapy because they recognize what Western medicine often forgets. The body works as a single interconnected unit. The tightness in your hip flexors affects your lower back, and the tension in your lower back directly affects your pelvic floor and, yes, your potency. This massage technique is not something I invented. It's an ancient wisdom now validated by modern physiology. I recommend it to my patients not as a replacement for comprehensive care, but as a cornerstone of daily preventative maintenance. It's about empowering you to be the co-pilot of your own health journey. We are moving away from passive dependency, waiting for a problem to happen, and relying on a pill to patch it, to proactive mastery, using simple daily actions to prevent the problem in the first place. It's about investing 1 minute a day to ensure decades of future comfort and confidence. So let's locate this crucial command center and learn how to use it. We've established the why, the mechanical bottlenecks of circulation, tension, and nerve compression. Now, for the how, the execution. But before I show you the exact location and technique, we must address the 5 biggest mistakes men make when trying self-care practices like this. Avoiding these pitfalls is the difference between quitting after 3 days and seeing life-changing results after 3 weeks. Mistake 1, aggression over finesse. Too much, too hard, too soon. The error, treating this delicate area like a deep tissue sports massage on a hamstring. Men are conditioned to think more pressure equals more results. Biologically explained, the perineal area is an intersection of delicate nerves and highly vascularized tissue. Aggressive deep pressure doesn't break up tension. It can cause inflammation, irritate the pudendal nerve further, and create microtrauma in the tissue. This inflammation actually worsens the circulatory chokehold you are trying to fix. Practically explained, if you are sore the next day, if you feel bruised, or if you feel a radiating unpleasant sensation, you have gone too hard. The correct pressure is the ripe tomato check, firm enough to slightly indent the tissue, but gentle enough that it feels therapeutic, and slightly tender, never painful. Emotionally explained, pain leads to avoidance. If the practice is uncomfortable, your brain will label it as a chore or a punishment, and you will quit. We are aiming for a sense of relaxed, intentional self-care, not a self-inflicted medical procedure. Ease up. Consistency at a gentle pressure beats intensity every time. Mistake 2, the dry rub. Ignoring the oil protocol. The error. Attempting the massage without any carrier oil or using the wrong substance like petroleum-based products or sticky lotions. Biologically explained. The oil is not merely a lubricant. It's an active therapeutic ingredient. Dry massage creates excessive friction on the superficial skin layers, which can lead to irritation and the formation of micro tears. More importantly, it doesn't facilitate the deep tissue penetration necessary to address the root vascular issues. The right oils like castor oil carry powerful anti-inflammatory molecules deep beneath the surface, transforming the mechanical action into a mechanochemical treatment. Practically explained, friction. You want to glide, not rub. Dry skin prevents the deep, consistent pressure you need. Using the wrong products like heavy mineral oils can clog pores and counteract the natural hormone, supporting benefits of natural oils. The oil is half the prescription, emotionally explained. A warm therapeutic oil makes the practice feel like a ritual rather than a necessary inconvenience. It engages your sense of touch in a comforting way, which is vital for reducing the stress hormones that interfere with function. Mistake 3, the weekend warrior mentality. Inconsistency, the error, trying the massage for 3 or 4 days, seeing only minor changes, and quitting because you didn't get a miraculous result. Biologically explained, we are trying to retrain decades of stagnation and chronic muscular clenching. You don't get fit after one workout, and you don't clear a traffic jam with one pass of a traffic cop. The body responds to consistency. It takes time for the arterial walls to regain elasticity, for the metabolic waste to be fully flushed, and for the nervous system to feel safe enough to truly relax the pelvic floor muscles. Practically explained, expect initial improvements in sensation and relaxation within 7 to 10 days. Expect significant, measurable changes in consistency and firmness after 4 to 6 weeks. If you miss a day, don't try to make up for it by doing 10 minutes the next day. Mistake 1, just get back on your 1-minute daily track. Emotionally explained, this mistake stems from a desire for instant gratification. This practice requires patience and self-trust. When you stick with it, the emotional reward isn't just better function. It's the profound satisfaction of knowing your body is responding to your intentional care. You are proving to yourself that your system is still repairable, still responsive. Mistake 4, poor positioning and strain. The awkward angle, the error. Trying to perform the massage while standing awkwardly or sitting in a strained position that causes hand or wrist cramping. Biologically explained. If your core muscles are tense or you are straining to reach the area, the very muscles you are trying to relax, the hip flexors and pelvic floor will be tensing up, effectively fighting against the massage. You cannot relax a system that is actively being strained. Practically explained, you need a comfortable, stable position that allows you to apply pressure at the correct angle without effort. I recommend 2 primary positions. Lying down on your back, knees bent, feet flat on the floor. This completely relaxes the hips and pelvic floor, allowing deep, easy access. Edge of the chair. Sitting on the forward edge of a sturdy chair with your feet flat and knees wide, this slightly opens the area and gives you excellent leverage. Emotionally explained. Awkwardness leads to avoidance. If you are struggling to reach the 1 minute, will feel like 5, and you will eventually abandon the habit. Make it easy. Make it comfortable, make it repeatable. Mistake 5. Focusing only on the event, creating performance anxiety. The error. Only doing the massage immediately before a planned intimate moment or viewing the practice solely as a pre-game necessity, biologically and emotionally explained. When you link the massage only to performance, you instantly add pressure, stress, and expectation. This spike in anxiety triggers the sympathetic nervous system fight or flight, which dumps cortisol and adrenaline into your system. These hormones are potent vasoconstrictors. They literally shut down blood flow to the non-essential systems like the erectile tissue. You end up fighting your own chemistry. The solution: frame this as daily maintenance for overall pelvic health, like brushing your teeth. Do it at a neutral time after your shower, before bed. The goal is to build a healthy, functional system 24/7 so that the response is natural and effortless when the time comes, not forced and stressful. Now that we've eliminated the common pitfalls, let's get specific. Here is the complete protocol for turning 60 seconds of focused touch into deep systemic health. I. Locating the command center, the perineum. The spot is called the perineum, or in the lexicon of traditional Asian healing, the Hui Yin point, a place where the fundamental energy channels of the body converge. The anatomical guide. This area is the diamond-shaped region situated exactly halfway between the base of your scrotum and the tip of your tailbone. Coccyx. You want the central, fleshy, soft tissue section right in the middle of that forward half. The tender clue. Gently probe the area. You will find a point that feels slightly different, perhaps a soft indent. And when you apply moderate pressure, it will be noticeably more tender than the surrounding tissue. This tenderness is a great indicator that you found an area of chronic tension and vascular stagnation. This is your target. The why. This location is critical because it sits directly above the bulbocavernosus and ischiocavernosus, muscles, the core powerhouses of the pelvic floor that are essential for rigidity and ejaculatory force. It is also the junction point where the internal pudendal artery dives into the deepest part of the pelvis to supply the penile tissue. Second, the technique. Refine your 60-second protocol. Once you have established your comfortable, relaxed position, knees bent, lying down is often best, and warmed your oil. Follow this minute long sequence. Step 1, application, 5 seconds. Use enough warm oil, about a teaspoon, to coat the entire area. Let the warmth of the oil relax the skin surface. Step 2, the pressure check. 5 seconds. Place your index and middle fingers, or just the middle finger, whatever is most comfortable, on the spot and apply your ripe tomato pressure. Firm but comfortable. Take a deep, slow breath. Step 3, the circular pump, 30 seconds. Using that moderate pressure, begin small, slow circular movements. Perform the motion clockwise for 15 seconds. Visualize the movement, encouraging stagnant blood to flush out and fresh blood to flow in. Perform the motion counterclockwise for 15 seconds. This ensures you are reaching all the surrounding muscular fibers and nerve endings. Step 4, the press and hold decompression, 20 seconds. Switch to a press and release pattern. Apply firm pressure, holding for a slow count of 5 and then fully release for a slow count of 5. Repeat 2 to 3 times. This focused, sustained pressure is invaluable for nerve release, helping to decompress the trapped pudendal nerve branches. Muscle release, targeting specific trigger points, knots that have built up in the deep pelvic floor muscles. Step 5, the deep breath finish. 5 seconds. Remove your fingers and take one final deep, slow breath, inhaling into your belly diaphragm and exhaling completely. This reinforces the parasympathetic state, the optimized oil protocol, more than just lube. The oil is your therapeutic medium. I recommend starting with one of these 3 options to maximize the benefits. Option A, castor oil, the deep tissue penetrator, why it works biologically. Castor oil contains over 80% ricinoleic acid, a powerful, unique, anti-inflammatory fatty acid that has an unparalleled ability to penetrate deep fascial layers. When applied topically, it has been shown to improve localized blood flow and reduce the type of deep inflammation that causes tissue stiffness and vascular constriction. The practical advantage, it gives you a therapeutic depth that lighter oils cannot match. Use a high-quality, cold-pressed, hexane-free organic castor oil. Option B, black seed oil, the hormonal and circulatory booster. Why it works biologically? Black seed oil, Nigella sativa, is a powerhouse of compounds, most notably thymoquinone. Studies have linked black seed oil to improve blood flow, reduce systemic inflammation, and even modest support for natural testosterone production. It's been used in Middle Eastern medicine for thousands of years. specifically for male vitality. The practical advantage, it's a more expensive option, but many men report a more profound feeling of internal warmth and rejuvenation. Option C, the enhanced carrier blend, the custom mix. The blend. Mix equal parts castor oil and coconut oil for scent and antimicrobial properties. The booster. Add 3 to 4 drops of high-quality rosemary or peppermint essential oil per ounce of carrier oil. Rosemary is a powerful circulatory stimulant, and peppermint creates a cooling, invigorating sensation that signals immediate blood flow increase. Caution: essential oils are highly potent and must be diluted properly. Never use essential oils directly on this sensitive area without a carrier oil. Fourth, the synergistic boosters, the force multipliers. To ensure the massage is working at its peak, incorporate these simple habits into your daily life. Hydration, flushing the pipes. The increased circulation from the massage releases metabolic waste and toxins from the tissue. If you aren't hydrated, this waste sits and stagnates. Aim for half your body weight in ounces of water daily. Good hydration equals better blood flow and efficient waste removal. Hip flexor stretching. Releasing the pull. The deep hip flexors and inner thighs. Adductors are anatomically connected to the front of your pelvic floor. When they are tight from sitting, they pull on the entire structure, causing the perianal tension you are trying to release. Simple stretches like the butterfly stretch or pigeon pose for 60 seconds after your massage can dramatically improve your results. Visualization, the mind-body connection. During the 60 seconds, don't just mechanically rub. Visualize the area. Imagine the muscles softening, the tight knots dissolving, and a bright, warm, fresh stream of blood rushing into the area, carrying healing oxygen and nutrients. This mental focus significantly amplifies the parasympathetic relaxation response. Gentlemen, I want you to step back and look at this practice not as a performance tool, but as an act of fundamental self-respect. The emotional toll of physical decline is immense. It's the constant subtle fear of embarrassment, the avoidance of intimacy, the loss of that quiet internal assurance that you are still vital, still powerful. When you commit to this 1-minute daily practice, you are making a commitment to your holistic dignity. And the beautiful thing is, when you fix the central mechanical bottleneck in your pelvis, the benefits ripple out to every aspect of your life, often in surprising and profound ways. 1. Reclaiming bladder command. The practical relief. One of the most common reports I get from patients who commit to this is a dramatic improvement in urinary function. That annoying post-void dribbling that requires you to shake and wait often disappears. More profoundly, many men report a significant reduction in nocturia, those disruptive multiple nighttime trips to the bathroom. The emotional impact, the freedom from constantly worrying about small leaks or interrupted sleep is massive. You sleep better, you're less irritable, and you feel more in command of your bodily functions. This is a foundational comfort. 2. Freedom from chronic lower body pain. The practical relief. Your pelvic floor is the anatomical core of your body. When it is chronically tight and congested, it pulls on its attachments to the lower spine and hip joint. I've had patients come in for potency issues only to call me later saying, "Dr. Narita, my chronic 5-year long lower back pain is gone." The emotional impact. This is the return of physical freedom. Imagine being able to stand, sit, walk, and exercise without that nagging stiffness in your hips or the persistent ache in your lower back. This freedom improves your mood, encourages more activity, and further boosts blood flow and health. It allows you to engage fully with life, your hobbies, and your grandchildren. 3. Enhanced core power and stability. The practical relief. When the pelvic floor is relaxed but functional, your entire core system works better. For men who golf, cycle, run, or lift weights, a healthy pelvic floor provides a stable foundation. You'll experience better stability, less fatigue, and improved athletic recovery because the root of your strength is no longer choked off. The emotional impact. This is about confidence in motion. It's the self-assuredness that you can still perform physically, still maintain your strength, and still keep up with the demands of an active life. The 1 minute of massage is simply the catalyst. The profound change is the comfort, the freedom, and the restored dignity you feel when your body starts working for you again, not against you. Gentlemen, you stand at a crossroads. You can accept the cultural myth that says decline is inevitable. That discomfort is just part of it, and that expensive temporary pills are your only solution. This is the path of passive surrender. Or you can choose the path of proactive mastery. You can invest 1 focused minute a day on a simple, proven technique that improves the mechanics of circulation, reduces deep tension, decompresses vital nerves, and supports your natural function from the inside out. We maintain our expensive cars. We service our home appliances. We wouldn't let a traffic jam persist at the most crucial intersection in our city. Why wouldn't we afford the same respect and maintenance to the most complex, beautiful, and vital system? We own our own body. The investment is trivial. A minute of time, a few dollars, or a good oil, and the willingness to try something different. The return is immense. Restored function, better physical comfort, reduced anxiety, and the quiet, enduring confidence that comes from knowing you are taking definitive, meaningful action to command your health. Here is my final challenge to you. Try this for 30 days. Commit to the 1 minute routine morning or evening with the proper oil. Don't judge the results on day 3. Judge them after day 30. Pay attention to the subtle shifts, the improved sleep, the sharper sensation, the reduced hip tension, and the quiet return of confidence. I assure you, your best years do not have to be behind you. With the right knowledge and simple, consistent practices, you can maintain and even improve your vitality, your health, and your command. Well into your later years. If this information resonated with you and gave you a sense of hope, hit the like button right now to affirm your commitment to this journey. Subscribe to the Dr. Narita channel. I'm here every week providing practical science-backed solutions that go beyond the usual tired advice. And most importantly, drop a comment below. Tell me, what's the one change you've already noticed since being more proactive about your health? Your story will not only inspire me, but it will encourage another man who is still struggling in silence. Take command, gentlemen. You deserve the comfort, the freedom, and the confidence that comes with a body that functions at its peak. I'll see you in the next